Hi friends, welcome back to my channel Mookambika Nursing. Friends, here we are discussing questions for RRB Nursing Superintendent exam. Also, these questions will helpful for your DME staff nurse exam and other nursing officer exam preparation. If you are watching my channel first time, kindly go through my previous videos. So many questions are there. It will helpful for your exam preparation. We can see the first question. A baby is born with fused eyes, single nasal chamber and undeveloped callosum are seen in options. Option A, holoprosencephaly. Option B, plakocephaly. Option C, schizencephaly. Option D, brachycephaly. Our question is, a baby born with fused eyes. Both eyes are fused and single nasal chamber. Only one nasal chamber and undeveloped callosum. Okay, are seen in case of holoprosencephaly. Option A is the correct answer. This holoprosencephaly is one of the birth defect. Some of the risk factors we can see, that is during the time of pregnancy, if the mother experience such infections like rubella or cytomegalovirus or herpes simplex virus infection or syphilis, this can cause the development of this holoprosencephaly. Also, if the mother consumed alcohol or aspirin or lithium or antipsychotic drug or anticonvulsant or some hormonal therapy, all can cause this problem. Okay, or the birth defect. This is one of the birth defect. And the next question is, investigation of choice for hydrocephalus in infant is options. Option A, cranial USG. Option B, MRI. Option C, CT scan. Option D, X-ray skull. Which is the main investigation doing for a child with hydrocephalus or infant with hydrocephalus? It is option A, cranial USG. And the next question is, which finding is the best indication that fluid replacement for the client in hypovolemic shock is adequate? Options. Option A, urine output greater than 30 ml per hour. Option B, systolic blood pressure greater than 110 mmHg. Option D, diastolic blood pressure greater than 90 mmHg. Option D, respiratory rate of 20 breaths per minute. Here the question is, which finding is the best indicator that if the patient got adequate fluid replacement after hypovolemic shock? Hypovolemic shock occurs when the fluid loss from the body, mainly in case of hemorrhage or in case of dehydration and all, like blood loss or other body fluid loss cause hypovolemic shock. So we have to replace the body fluid. Okay, so here the question is, which is the best indicator that the patient got adequate fluid replacement? It is urine output greater than 30 ml per hour. Okay. That means once the fluid replacement or fluid got adequate means the urine output will gradually increase. So the urine output is greater than 30 ml per hour. That indicate that a patient got adequate or patient is getting adequate fluid replacement. Here next option B is systolic blood pressure greater than means it is fluid overload. BP will go high, and diastolic pressure greater than 90 also it is fluid overload. BP will go high. Okay, and respiratory rate 20 breath means it is normal. Okay, so the correct answer is option A. And the next question is, what is the correct order from outer to inner side of blood vessels? Options. Option A, tunica adventitia, tunica media and tunica intima. Option B, tunica adventitia, tunica intima and tunica media. And option C, tunica media, tunica adventitia and tunica intima. Option D, tunica intima, tunica media and tunica adventitia. And the correct order from outer to inner side of blood vessels is tunica adventitia, then in media and intima. Okay, option A is the correct answer. And the next question is, the neurotransmitter serotonin derived from which precursor amino acid? Options. Option A, dopamine. Option B, tyrosine. Option C, tryptophan. Option D, glutamine. Serotonin, which is derived from tyrosine. Option B is the correct answer. Tyrosine is the precursor amino acid for serotonin. Okay. And the next question is, Mid-arm circumference of newborn is options. Option A 10 to 12 centimeter. Option B 12 to 13 centimeter. Option C 12 to 15 centimeter. Option D 13 to 16 centimeter. Our question is, what is the normal mid-arm circumference of newborn? Here we can see the physical character of newborn. The normal weight is 2.5 to 3.5 kg and normal height is 45 to 50 centimeter and normal head circumference is 33 to 35 centimeter and the normal chest circumference is 32 to 33 centimeter. During the time of birth or newborn babies, the head circumference is higher than chest circumference. Okay, head circumference is 33 to 35 and chest circumference is 32 to 33 and mid-arm circumference is 12 to 13 centimeter. That is our question. What is the normal mid-arm circumference? And the correct answer is, it is option B, 12 to 13 centimeter. And the next question is, which is not a probable sign of pregnancy? Our options: option A gold sign, option B Braxton Hicks contraction, option C quickening, option D all of this. Here the question, which one is not a probable sign of pregnancy? Here we can see the signs of pregnancy. First one is presumptive sign. Presumptive sign include amenorrhea, fatigue, nausea and vomiting, breast changes, then quickening and urinary frequency. This is the presumptive sign of pregnancy. Okay, and probable sign, that is our question. Probable signs include gold sign, Chadwick sign, Hager sign, ballotment and positive pregnancy tests like serum urine test and Braxton Hicks contraction. Okay, these all are probable sign of pregnancy. And positive signs include hearing fetal heart tone or fetal heart sound, visualization of the fetus and palpating fetal movement, then visualizing fetal movement, all positive sign of pregnancy. In our question, which is not a probable sign of pregnancy? It is option C, quickening. Quickening is one of the presumptive sign of pregnancy. Friends, here we are discussing important questions for RRB nursing officer exam. These questions and important points will helpful for your exam preparation. If it is useful for your studies, please share my videos to your friend circle.